Unity Environmental University, Animal 303, Animal Science Medical Terminology, Week 3, Course Project, Canine Heartworm Disease. What is canine heartworm? Canine heartworm disease is a serious condition caused by a type of parasitic worm called the Dirophalarium amitis, a type of filarial nematode more commonly known as roundworm. It is spread through the bite of infected mosquitoes. These worms live in the heart, lungs, and associated blood vessels of infected dogs, causing significant damage. Environmental and climatic changes, both natural and those created by humans, along with animal movement, have increased heartworm infected potential. Heartworm life cycle. During the infective stage, a mosquito bites an infected dog and ingests immature heartworm larvae, microfilariae, from the dog's blood. Then, during the development in the mosquito, the microfilariae develop into infective larvae. The infected mosquito bites another dog, transmitting the infective larvae into the dog's bloodstream during the transmission stage. Moving on to the maturation stage, the larvae migrate through the dog's tissue, potentially causing local inflammation, redness known as erythema, and swelling known as edema. They eventually mature into adult heartworm in the heart and pulmonary arteries. Once mature, the adult female heartworm releases microfilariae into the dog's bloodstream during the reproduction stage and continuing the life cycle. Pathophysiology of heartworm disease. An example of three conditions that can occur from heartworm disease are pulmonary arterial disease caused by adult heartworms residing primarily in the pulmonary arteries, causing endothelial damage, inflammation, and obstruction of blood flow. Exudate fluid due to inflammation may occur. Right heart failure is another condition which may be a result of heartworms. The increased workload on the right side of the heart can lead to right ventricular hypertrophy and eventually right heart failure. This can manifest as ascites and peripheral edema in advanced cases. In severe cases, a large mass of worm can obstruct blood flow through the vena cava, leading to caval syndrome. This life-threatening condition that causes systematic hypotension, hypoxia, and organ damage. Where are the organs located of interest in this body? The organs of interest in a canine heartworm disease are primarily the heart and lungs, with blood vessels like the pulmonary arteries, vena cava, also being significantly affected. The heart is located within the thoracic cavity, specifically in the mediastinum, the central compartment of the chest between the lungs. It lies cranial to the diaphragm and dorsal to the sternum. The lungs are also housed within the thoracic cavity, surrounding the heart on either side. They extend from the base of the neck to the diaphragm and are crucial sites for inflammatory responses during heartworm infection, often presenting signs like erythema or edema due to inflammation of the affected blood vessels. The pulmonary arteries originate from the right ventricle of the heart and carry deoxygenated blood to the lungs. Located within the lungs, these vessels branch extensively to reach the alveoli. Damage to the pulmonary arteries from heartworm disease can lead to endothelial damage and subsequent exudate, potentially causing perivascular edema, purulent, and exudate in severe infections. Canine heartworm disease is generally considered a chronic condition. The development of heartworm disease is a gradual process. After infection through a mosquito bite, it takes approximately 6 months for larvae to mature into adult heartworms in the pulmonary arteries and heart. Early stages of the disease are often asymptomatic. Clinical signs such as coughing, exercise intolerance, dysphoria, typically develop gradually as the worm burdens, increase and decrease in progress. This can take months or even years. If left untreated, heartworm disease can lead to serious complications like right heart failure, Cabell syndrome, and even death. These complications often develop over time as the disease progresses. Therefore, the chronic nature of heartworm disease is evident in its slow progression, gradual onset of clinical symptoms, long term effects, and potential severe complications that develop. Why is it important to discuss heartworm disease? Widespread prevalence. Heartworm disease is unfortunately quite common in many parts of the world, especially in areas with warm, humid climates where mosquitoes thrive. Heartworm infection in dogs has been diagnosed globally, affecting multiple regions and climates. In the United States and its territories, heartworm is considered at least regionally endemic in each of the contingent 48 states: Hawaii, Puerto Rico, U.S. Virgin Islands, and Guam. This makes it a significant concern for dog owners. Preventable conditions. The good news is that heartworm disease is highly preventable with monthly preventive medications. These drugs act on the larvae in the subcutaneous tissue before they mature and migrate to the major organs. The FDA approved heartworm preventives currently marketed: ivermectin, milbemycin oxime, moxidectin, and selamectin belong to the macrocyclic lactone class of drugs. Misunderstood risks. There are many misconceptions about heartworm disease, such as the belief that indoor dogs are not at risk or that mosquitoes are not present during certain times of the year. It is important to educate dog owners about the intradermal risk posed by infected mosquitoes, the potential for the dermatitis at the bite site, and the importance of year-round prevention. While treatable, heartworm disease requires intensive treatment plan involving a series of injections that can lead to local arrhythmia or even purulent reactions in some cases. By discussing heartworm disease, we can raise awareness about its prevalence, severity, and preventability. This empowers dog owners to take the necessary steps to protect their furry companions from their potentially devastating condition. How is it noticed? Canine heartworm disease is a sneaky threat, often showing no obvious symptoms in the early stages. This makes regular veterinary checkups and preventive medication crucial. As the disease progresses, dogs might develop a persistent cough, tire easily, and show a lack of energy. More advanced cases can lead to increased coughing, difficulty breathing, weight loss, and swollen abdomen due to fluid buildup. In severe cases, life-threatening conditions called Cabell syndrome can occur, causing sudden collapse, pale gums, bloody urine, and jaundice. Since these signs can be associated with other conditions, it is important to consult a veterinarian for proper diagnosis and treatment if you notice any of these in your dog. How does the body compensate for this condition? When faced with the challenge of heartworm disease, the dog's body fights back with several impressive compensatory mechanisms. One of the first lines of defense is an increased heart rate, tachycardia, and stronger contractions. This helps push blood through the narrowed pulmonary arteries where those pesky adult heartworms are causing trouble. Over time, the right ventricle of the heart, responsible for pumping the blood to the lungs, thickens and enlarges. Right ventricle hypertrophy, like a muscle getting stronger with lifting weights. This allows it to pump harder and maintain blood flow despite the increased resistance. The body also gets creative with its plumbing. The pulmonary arteries themselves may widen and thicken to accommodate the increased pressure, and new blood vessels may even sprout up to bypass the blockages. The kidneys fight by retaining fluid to boost blood volume and improve circulation, though this can unfortunately lead to edema, including ascites. Finally, the blood ramps up production of red blood cells to maximize oxygen delivery to the tissues, counteracting the effects of decreasing lung function. Diagnosing heartworm disease involves a combination of tests to confirm the presence of adult heartworms, microfilaria, and to assess the extent of damage to the heart and lungs. One of the primary tools is the antigen test, which locates specific proteins released by adult female heartworm. A positive result confirms their presence, while a negative result might require further investigation. Also, to assess the impact of worms, veterinarians use imaging techniques. X rays provide a view of the heart and lungs, revealing signs of subcutaneous swelling, changes in the lung patterns. In some cases, granulation tissue may form around damaged blood vessels as the body responds to the chronic infection. Echocardiography, an ultrasound of the heart, provides a more detailed look, allowing the veterinarians to actually visualize the adult worms lurking in the heart chambers and pulmonary arteries. This also helps assess the heart function and identify any abnormalities. In conclusion, canine heartworm disease is a serious but preventable condition. Understanding its causes, clinical signs, diagnostic methods, treatment options empower the dog owners to take proactive steps in protecting their furry companions. By prioritizing prevention through regular medication and veterinary checkups, we can help dogs live long, healthy lives free from the burden of heartworm disease.